At the beginning of a public health crisis or outbreak, information is critical. Analysis of publicly available information and media sources is often secondary to public health stakeholders who face funding and staffing shortages. Yet the findings gleaned from these data sources can provide pivotal real-time forecasting and insight that can save lives in the fast-paced environment of public health response. FADS addresses these issues by filling information gaps and increasing public health response time. Through consistent near real-time monitoring of publicly available sources, FADS 1 identifies anomalies in coverage of key public health symptoms and terms, and 2 measures and assesses potential health threats. Our example for today will be investigating the African continent during the pandemic, especially the early days of the pandemic. In March and April 2020, traditional news outlets stated that Africa would be relatively unscathed compared to the rest of the world for COVID-19, largely owing to its youthful population known as the youth dividend. However, I remember rejecting this argument back at the early days of the pandemic. Rather, I contributed the lack of cases to low number of COVID testing and COVID test kits available on the continent. So to investigate this narrative that the African continent would be unscathed by the pandemic, my colleague Jake Hazen and I built the Public Health Anomaly Detection System. FADS leverages Bollinger Bands, a statistical model often employed on Wall Street, to predict and observe the volatility of financial markets and whether to buy or sell stocks. But rather than stock prices, FADS takes a 20-day moving average, you can see the gray line there, of public health key symptoms and health terms. So for this example, mentions of fever. Based on that 20-day moving average, a 95% confidence interval on the top and the bottom is formed. And if this was the stock market, that anomaly on the top side would indicate a good time to sell the stock, and on the low side, a good time to buy. But for FADS, we're most interested in the upper bound, as an anomaly indicates a statistically significant increase in the number of mentions of, in this case, fever, a sign of a potential public health threat. When calculating that difference of anomaly from that expected value of the 95% confidence interval on that high side, we can take that difference in calculation to understand how large of an anomaly is occurring. I conducted analysis on 12 different public health symptoms and health terms from March 2020 through February 2021, which included flu, coughing, fatigue, muscle pain, headache, loss of taste, loss of smell, sore throat, runny nose, nausea, vomiting, diarrhea, and overcrowding of hospitals. After compiling and stacking the symptoms divergences from the 95% top interval, it is clear that COVID-19 existed in Africa in late March and early April, despite those traditional news narratives that the continent was unscathed by the novel virus, and weeks before the government had adequate testing capacity. Just to conclude, a few benefits of the Public Health Anomaly Detection System. 1, FADS permits stakeholders of all levels, international, national, and local, to better track emergence and outbreaks of disease. 2, fill information gaps. And 3, it doesn't require significant oversight or inputs from users. Rather, it's an organic, self-regulating reflection of the target media environments. I invite you all to come visit us in our booth and learn more about FADS, and also get a demo of Next-Gen Mission Analytics, which a lot of you have done, which is our open source media aggregation tool, which we use to do media monitoring on the public health front. Thank you very much for your time.